The next few weeks will be extremely crucial for India in its fight to contain the spread of COVID-19. India had two options: take the Chinese route in stopping the outbreak with an iron-fisted lockdown, ensuring social distancing and self-quarantining, or go the Italian way with a delayed response, causing a rapid spike in cases which could overwhelm the healthcare system. So far, India has 476 confirmed cases and 9 deaths. Scientists believe if India can implement China-like quarantine measures, the number of cases may remain under 1,000 by the 15th of April. In the worst-case scenario, if India fails to control the progression of the disease's spread, it could go the Italian way. And then the number of cases could surge to nearly 3,500 by the 15th of April. India is ahead of the curve in enforcing the lockdown. It took 3 weeks for China to acknowledge the virus outbreak, and by then millions of people were traveling to visit friends and family for the Lunar New Year. In Italy, a nationwide lockdown was implemented only after 9,000 people had tested positive. That gives hope to India. With under 500 cases amid a lockdown, the spread can be stemmed if social distancing norms are strictly followed. However, it is a matter of concern that 60% of Indians think that the threat of COVID-19 is exaggerated, according to a Sea-Water survey. But the centre has advised states to enforce the lockdown with an iron fist. 2/3 of districts in the country are under a lockdown to enforce social distancing. Data suggests that younger people face a lesser risk of contracting COVID-19, but they also stand the risk of spreading it to older people. Both India and Italy began shutting down schools at around the same time. The first school closures in both the countries started in early March. By then, Italy had already recorded over 3,000 cases, whereas India had less than 50 confirmed cases. Another reason why Italy has recorded an exponential surge in coronavirus-related deaths is because of its elderly population. 23% of Italians are over 65 years old, the second oldest population in the world after Japan. The average age in Italy is 45, one of the highest in the European Union. On the other hand, the average age in India is 28, one of the lowest in the world. An analysis of the deaths in China shows more than 80% of those who lost their lives were elderly, over 60 years old. The last factor to understand here is the mortality rate. Italy has the world-leading mortality rate, 9%. China's mortality rate stands at 3.8%. India has the lowest mortality rate at 2%. While the world battles the deadly disease, China is slowly returning to normalcy. The Great Wall of China has now reopened, but India's iconic Taj Mahal remains.